Cancer is a disease that still continues to be a big threat prevalent in the society. In fact, after cardiovascular diseases, cancer stands second in terms of mortality, where cases of breast and cervical cancer continue to be on the higher side. In an exclusive interview with 𝗡𝗢𝗧 Live, Dr. Gayatri Gogoi, Associate Professor to Department of Pathology, AMCH in Dibrugarh, and prominent cancer researcher termed 𝗡𝗢𝗧𝗛 as the hub of cancer. Speaking candidly, Dr. Gogoi also stressed on creating awareness among the masses regarding cancer, its causes and its treatment.
If we talk about the whole of health sector or health scenario, cancer still remains to be a major threat for mankind. In Assam also, if we talk about cancer, the situation is quite alarming and even many say it's quite dangerous also. Yes, we know that a lot of research has been done, but there is still more work to be done. At the Assam Medical College and Hospital in Dibrugarh, there are a lot of work being done particularly at the Department of Pathology, and we have with us today to discuss on this and more, to know more on this, Dr. Gayatri Gogoi, who is an Associate Professor of Pathology and also a cancer researcher, she has done quite a lot of work in various fields across the Northeast on this issue of cancer and different types of, in fact, cancer. So let us go to Dr. Gogoi and to know about the prevailing situation as of now today.
It is really an alarming situation in Assam as well as in the Northeast. Currently, as you know, globally itself, cancer is the second cause of death. And as well as in India, it is out of 10 person, one diagnosed with cancer. And Northeast is, again, if you compare nationally, you will see that out of 6 or out of 4 person develop cancer in Northeast. So even in comparison to national scenario, Northeast has more cancer incidence. So that is why it is called cancer hub. That is why the awareness is very important. Second part is proper infrastructure is extremely important to diagnose as well as treat the disease. And the society is equally be equipped to it proper gear. It means the awareness to where to go, how to get the treatment. So that is why the discussion today we are having is going to play a very pertinent role spreading awareness. As far as research is concerned, I am associated with breast cancer research. I mean, compared to rest of the world, Northeast in Assam, the women are having cancer at much younger age group than the rest of the world. And the type of triple negative cancer, if I want to be more specific, which is more aggressive type of cancer, is more common. However, number 2 cancer is cervical cancer in female, where that screening, even before one develop proper cancer, the earliest phase of the diagnosis can be made without symptoms. Nowadays, even the vaccines are available. So a lot of issues are there which we need to discuss from time to time.
And not just this, Dr. Gogoi also spoke about growing cases of chronic Mylogenous leukemia, which is commonly referred to as blood cancer.
Common people are very familiar with the word blood cancer or leukemia. What is chronic myelogenous leukemia, or shortly CML? It is a type of blood cancer where a person develops cancer. We know that he developed cancer, he has high WBC count, abnormal platelet count and anemia. And you know, this is the first cancer where it was known that cause is genetic. So that is one cancer for the first time scientific community came to know that cancer is a kind of have link with the genetic material or chromosome. So after that, in 2001, there was a trial by Dr. Drucker, Brian J. Drucker, who did a trial with a drug called imatinib mesylate, and he treated 54 patients by that medicine. Then he have seen that 53 cases recovered and blood count remained normal. And after that, FDA approved the drug for the treatment of chronic myelogenous leukemia. It is a huge success that was published in New England Journal of Medicine. More positive sign is that imatinib is now available in government hospital, and 20%, except 20%, 80% cases can be very much controlled with the drug called imatinib mesylate. So that is the positive story from scientific perspective. From the patient perspective, however, they have their own problem. If someone diagnosed at the age of 30 years, that means he need to take the drug for his entire life, and he need to do a follow-up test which is costlier, which most of our hospitals we do not have. But however, currently we are having this test facility, we are developing that. That is why we are organizing a program in Assam Medical College, where on 22nd September there will be a special OPD for chronic myeloid leukemia patient, followed by there will be an interaction between expert and the patient.
She further added that there has been a rise in pediatric cancer cases, especially among the tea garden children.
Even though we expect more in adult population, we have seen even there are a good number of pediatric population. Children are also suffering from the disease. But I do not want to simplify that what is the cause, but interestingly we have noticed, and it is concerning also, small children who are suffering from this disease, most of them are from tea garden area. We exactly do not know why. Is it by chance or it is a true picture of the situation? So maybe after some time we will come to know. So it is really concerning that even we have children, they have this chronic myelogenous leukemia, which we expect more in adult population. We have cases like 7 years, 8 years, 13 years. So it is a well-established fact that chemicals are highly harmful for our body, whether it is present in water, present in air, present in soil. If it is present in water and air, that means it will be mixed up with whatever we eat. That means if there is a plant, there is fruit, there is other eatables, that chemicals will mix up and we will eat, and that in long run going to be harmful. And it is even more harmful.
We know that tea gardens use a lot of pesticides during their production. So is it possible that during this use of pesticides, people are getting this blood cancer at a very tender age, as you say?
It is, at the moment, it is very difficult to simplify it, but chemicals are definitely one of the reasons. But as we have Indian Council of Medical Research, to find out the exact reason, we need to frame a design for a research project. But yes, over the years for us also, if we get more number of children from that particular area, we will also recommend to do such research project which will link that particular chemical exposure and to occurrence of the disease. But that will take little longer time to understand. But overall, we all are aware that chemicals are extremely harmful for not only for cancer, even for other diseases.